So this is Lewis Blackman. He's 15 years old. He was admitted for surgical repair of his pectus excavanosum. He's been complaining of some itchiness, and he's currently on hydromorphone for pain control and Toradol as well. I haven't been hearing any bowel sounds, but I'm thinking that's related to the hydromorphone. And yeah, I hope you have a great shift.
Okay. Hello, my name is Nurse Katish. I'm just here to do an assessment on you. And by the way, I'll be your nurse for today. Can you go ahead for me, please, and verify your name and your date of birth?
Lewis Blackman, January 1st, 2016.
Okay, Lewis, are you allergic to anything in the environment, any medication, or any food?
No.
Okay. I've been hearing that you are experiencing some itching and some stomach pains. Is that so?
Yes, I'm so itchy, and I haven't gone to the bathroom.
Okay, let me see if there's an order put in for the itching. Okay, I'm seeing here where you were actually prescribed hydromorphine and Toradol, and that will be for your pain. How's your stomach pain?
My stomach hurts so bad.
Okay, so can you give it a scale from 0 to 10, from 0 being no pain, 10 being the worst pain ever?
11.
Oh wow, that sounds awful. We might need to look into giving you some more of that medication. But before I do so, let me go ahead and listen to your stomach sounds. Okay, I'll just notate this in your records, see what's happening, and I'll go ahead and increase the dose of your tramadol or your Toradol actually to see how best that will help you with your stomach pain, okay? Alright, so you have your call button right there, and if you need me, you know, if it doesn't work within the 45 minutes, you can always call me, okay?
Okay.
Still in pain. Yeah, he's experiencing a lot of pain. His stomach's still in pain. I don't know what to do. Could you please help me out?
I do understand your concerns. You know what I'll do? I'll go ahead and raise this concern to the charge nurse and see what she says about it, okay?
Okay.
Thank you.
Thank you.
Hey, Nurse Madeline. Hi. I have a patient in number 6 over there, and I'm a little bit concerned. I'm seeing where he's on Toradol, but he's complaining of itching, and he actually has no bowel sounds. I don't know, maybe we could look into something different, another treatment for him or something.
Sure. Let's go and assess him.
Okay, we can do that.
Not yet.
Hi, Mom. I'm here with the charge nurse as promised. You know, you had some concerns regarding his pain not improving and stuff like that. So we're just here to assess him to see what else we can do, okay?
Hi, Mom. Like she mentioned, like Katish mentioned, I'm Madeline, the charge nurse. And then I'm just going to do a little bit quick assessment for him to see what's going on, okay? I heard that he's having a lot of pain. Okay. Hi, Louis. Are you doing okay? Where's your pain at? Okay. You just said that the pain was in the abdomen?
Yes.
Okay, I'm going to go ahead and check the abdomen here real quick. And then, any pain? Alright, let's try I see that the doctor ordered some labs. Have you been able to do the labs yet? An ID?
Actually, I tried to get some blood from him, but I wasn't able to get anything. I was not successful.
Yeah, he looks really bad, like really bad. Okay, let's try to, let's see if we can get any blood. Let's try again to get some another IV. Okay.
Everything's going black.
Hey, Louis? Louis?
My baby.
Can you call a rapid?
So we're meeting today because we've had a failure to rescue a patient, and so we've had a patient who expired, Mr. Lewis Blackman. This is a very serious situation. but it's crucial that we learn from this, so we prevent future incidents. But we also want to foster a culture that encourages error reporting and to prevent occurrences. And so we want to focus on what went wrong rather than who to blame. And our priority now is to support the nurse as well as to ensure that we have a thorough investigation into the responsibility of the nurse in medication administration, making sure that the 10 rights are not tampered with. And then we also want to ensure that we're following what the procedure is when a medication error occurs at this facility, which is documenting and doing what we're doing now, basically documenting, submitting the error. I've called in the state board, and we also have risk management here to ensure that we're doing well with the charge nurse and the nurse.
Okay, as it relates to this event, I must first say that I have accepted my part in this medication error, and I truly regret this tragedy. And as a registered nurse, patient safety and following protocol is of high importance. And since the Sentinel event occurred, I have gone back to the drawing board to see what went wrong and what went right. I mean, there are 10 rights to medication administration, which include the right dose, the right time, the right person, the right medication, the right route, the right assessment, the right documentation, the right education, the right evaluation, and also the right to refuse. And I think where I went wrong was with the right to dose and the right time. It is my responsibility, of course, to cover or follow the rights to medication administration, and those two things I completely omitted. And some of these rights we did follow, as I said. However, those were the two that I missed. Also, trusting my instincts as a nurse to speak up when something feels wrong. That's definitely something I could have looked into. This experience has profoundly impacted me, and I'm committed to learning from it, to prevent errors like this from happening in the future.
Hello, my name is Madeline, and I was working as the charge nurse the day of the incident. I was overseeing Lewis's case, and I was aware of his worsening condition by the nurse Katish. After she administered Toradol and also hydromorphone. The patient was complaining of, when I went into the room, the patient was complaining of severe abdominal pain. I noticed that his abdomen was distended, and I also noticed a change in the vital signs. At this point, I suspected that the patient could probably be in hypovolemic shock, and I called a rapid response and escalated the situation. However, unfortunately, the patient expired. He went into cardiac arrest. I did document it, including the observations of my finding, including the medication error. This error was a failure in the process. The incident led to incorrect medication delivery, dosage, timing, causing harm to the patient. In Lewis's case, the prolonged use of Toradol, which is NSAID, a non-steroid medication, exceeded safe usage guideline, especially considering the known risk for gastrointestinal bleeding associated with this drug. I then went ahead and escalated the situation, and I contacted my CNO.
Okay.
As part of the risk management team, we came in and we were able to analyze the situation, and based on Lewis's incident, we came up with a few risk factors that contributed to the medication error, which would include poor communication probably during the handoff or shift change, which increases the risk of errors. Another one would be failure to evaluating treatment plan before implementing it, leading to deteriorating deterioration of the patient's condition and death. And the one other factor will be interruptions or multitasking during medication errors.
Yes, just piggybacking off what Pinkett is saying. As risk management, we'd like to ensure that we have an open communication when an incident report is filed, so that we can thoroughly go through the report to see what exactly went wrong and identify potentially active risk factors, but also latent risk factors that we as the facility are potentially responsible for or should be responsible for. In other words, we could work harder to reduce the staffing ratios to nurses whenever there are critical patients on the floor. We could have potentially diverted some of your patient load that day, Katish, to make sure that you weren't overwhelmed potentially with having to monitor someone who had just left surgery. Another thing we could do is incorporate more medication guidelines into our EHR. It might have been an overstep with Toradol, for example, in the case of a pediatric patient, where we could have produced more pop-up warnings about when too much is too much, as well as potentially have more alerts to conduct more GI assessments to potentially have caught Lewis's situation earlier. And that is definitely something we will have to look into moving forward.
My name is Nancy and I'm with the State Board of Nursing, and basically when a medication error occurs, we would have a sit down like this and try to figure out where everything went wrong, and basically it's called root cause analysis. And answering some of the questions that we have, what are the standards of practice of medication administration? So you just follow the current guidelines and also facility guidelines. And who is responsible when an error occurs? Basically that we just go back to the nurse who administered the medication. And what happens when a medication error occurs? The facility would document the incident and notify the regulatory bodies, which is us, and then the root cause analysis would happen like this, and finally communicating with the family that the error occurred. So what the State Board of Nursing would do in this scenario would either be one, revoke the nurse's license, or give the nurse a formal warning, or require continuing medication for the nurse in charge, the nurse who did the medication error.
Okay, all right, thank you.
Does that conclude the meeting?
Yes.
Vivian?
So in this case, I don't know, I'm not sure what would happen in this case, if they would take your license or something like that.
Ready to cry?
And that's the end.
No, you're not.
Thank you.